What is HPV? Human papillomavirus, or HPV, is a common viral infection. So common that 8 in 10 people will get it at some point in their lives. People most commonly get HPV when they're between 15 and 25 years old, either through unprotected sex or skin-to-skin contact with an infected area. In fact, HPV is the #1 transmitted infection in the U.S. The infection first gets into your skin cells and hides in them, then uses the cell's mechanics to make more copies of itself. Most people don't have any symptoms, while others may develop warts. There are more than 40 types, which are grouped by their risk of causing cancer, low risk, and high risk. In fact, 30% of infection-related cancers are due to HPV. What happens if you get infected with HPV? Like other viral infections, such as common colds, most people who are infected are able to fight off the infection within months to years. But 10% of people do not clear the infection. As the virus continues to use the cell's mechanics, cells may become abnormal or precancerous, which is often referred to as dysplasia. This usually occurs over many months or years. Over time, some people may develop cancer in the cervix, vagina, vulva, penis, or anus. If someone is infected in the head or neck region, for example, they may also be at risk of developing head and neck cancer. What are the risk factors of getting an HPV infection? Higher numbers of sexual partners, lack of barrier protection during sex, such as using condoms, new sexual partners, weakened immune systems, such as people living with HIV, people with transplants, or people on chemotherapy. What are the risk factors for developing anal cancer from HPV? Tobacco use, such as smoking, weakened immune systems, such as people living with HIV, people with transplants, or people on chemotherapy. Having certain high-risk HPV types, 16 and 18. History of precancerous cells or dysplasia in the cervix, vagina, or vulva. History of precancerous cells or dysplasia in the anus. And anal sex. Frequently asked questions. But I've never had anal sex. Anal sex is only one way for HPV to get to the area. HPV can also spread through fingers, sex toys, or other nearby organs infected with HPV, such as simply wiping after using the toilet. If you have HPV or some of the risk factors listed, does this mean I will get cancer? Not necessarily. The overall risk of developing anal cancer is very low. But we want to keep you from getting cancer with close surveillance and screening, since this can cut your risk of developing cancer by more than 50%. Going from pre-cancer to cancer occurs over a very long time, usually many years. This gives us the perfect opportunity to prevent cancer through screening and surveillance. If I'm infected with HPV, can I be cured? Unfortunately, there is no specific cure for HPV. Most people can clear HPV on their own, but higher-risk patients may not be able to and become long-term carriers. Is there a way I could have prevented myself from getting infected? HPV vaccines are routinely recommended for adolescents and young adults ages 9 to 26. Even if you're currently infected, you may still benefit from vaccines against high-risk HPV types. We are honored to care for you. Thank you for choosing the James.